Good evening. I'm Metro Health Director Claude Jacob. I'm joined by Bexar County Judge Nelson Wolf, Metro Health Assistant Director Dr. Anita Kirian, and University Health's Executive Vice President and Chief Medical Officer Dr. Brian Alsip. Let's look at our progress and warning indicators again. Our positivity rate dropped this week to 16.9%, with more testing occurring in schools and the community. Please know that our hospital systems are still under severe stress. Our daily COVID hospitalizations, ICU admissions, and those on ventilators increased when compared to last week. Overall, we remain at the severe risk level. Just a quick note, we have been notified that there have been some phishing emails circulating claiming that they are with the county and are tracking vaccines. This suspicious email is requesting people to fill out a form with the personal information. The county has not sent out anything like this and does not ask residents to provide personal information by email. Regarding our cases, today we are reporting 1,382 cases of COVID-19. Our 7-day moving average is 1,597. We are sadly reporting 7 new deaths. To date, we've lost a total of 3,710 friends here in San Antonio, neighbors, and loved ones to this virus. Please keep them in your thoughts and prayers. At this time, 65.9% of Bexar County residents are fully vaccinated, and 81.8% of residents have received at least one dose. There are 1,382 patients in area hospitals. There are 212 new admissions, 22 of which are pediatric cases, 371 in ICU, and 253 on ventilators. 87% of patients in area hospitals are unvaccinated. Now to the judge.
Thank you, Claude. Let me first express my sorrow regarding Governor Abbott's contacting Covet. He has no symptoms at the time, but he is given an infusion of Regeneron. I want everybody to know that is available here in San Antonio. You need to get your doctor's prescription. It's out at the Bexar County Expo Hall. They will give you all the instructions of when your appointment is and when you can go out. Since we started this last week, we've given about 500 infusions, as many as 80 in one day. So that does help you and prevent you, hopefully, from going into the hospital. So I would urge you, if you've got COVID and you've got some symptoms, get hold of your doctor, and you may want to take advantage of using the same thing that the governor's using today. Let me tell you, we got a new hero here in San Antonio, and that's Superintendent Pedro Martinez. The Attorney General sued him today. That's a badge of honor as far as I'm concerned. I want to thank him for mandating school masks and for requiring vaccinations. Also want to thank the Northside School Board, who voted yesterday to mandate masks. I got a call from Superintendent Lloyd Versta today from Southwest School District. They're going to be doing the same thing. So the school districts across the state are stepping up and saying we're going to take care of our children and make sure that we do everything we can by mandating the face mask and protecting them from COVID. The lawsuit that we got the temporary injunction on I think just a few minutes ago, the Fourth Court of Appeals upheld that injunction. Now, the temporary injunction means that the governor's order is not effective until the trial date of December 13th, I think. Of course, they will appeal it to the Supreme Court, and we may not do so well there, but a good victory today by the Fourth Court of Appeals upholding the temporary injunction against the governor. We're getting about 200 patients every day going into the hospital. Hospitals are doing a much better job by being able to move the patient on out, whether it's to a long-term facility, whether it's a nursing home, or whether they're going back home. It's younger people that are going into the hospital today, so that they're recovering a little quicker. But 200 almost every day is going into our local hospitals. Bexar County Hospital, and you'll hear in a few minutes from Dr. Brian also, but they are looking at maybe as soon as we know about the booster shot or the third shot, maybe opening up back up at Wonderland Mall. We're waiting to see what the timeline will be on that. We're preparing for it in case we do get the vaccines to be able to do that. We did receive 295 nurses that began working in our local hospitals. We expect another 315 to come very soon. I want to thank Lieutenant General Laura Richardson. By the way, she's just going to get a 4th star. The Army North is setting up again to help in 6 different states with respect to nurses and nurses' aides. So, again, thank General Richardson and Army North for doing that. That's all I got, Claude.
Thank you, Judge. So, to find a testing location, visit covid19.sanantonio.gov. You can also call the COVID-19 hotline by calling 311 and selecting option 8. Please wear a mask and get vaccinated. Do it for you. Do it for your family. Do it for San Antonio. Again, to get the latest news and information, please visit covid19.sanantonio.gov. Now we will take questions from our reporters.
Can you tell us whether Regeneron is being used for children in San Antonio, and is it advised to use for children? Would you encourage parents to do it?
I just talked with them not earlier today, and the 500 people that we've had coming out there are 18 and older. They're not taking anybody younger than 18. And but it's interesting that many of the ones coming out there are young, or 18 years old in younger categories. So, but they're not taking anybody under 18 is what I was told.
And then Director Jacob, specifically, can you explain and tell us what medications and or treatment children fighting COVID are getting right now?
You can ask. Dr. Alsop, if you want to take that question.
Sure. Well, like the judge said, that Regeneron right now is used primarily, at least at the Regional Infusion Center, in those individuals 18 and older. But as far as children who are admitted into the hospitals, there is no limitation on the types of medications that are available to them, whether they have severe disease. Once they're admitted, the same type of treatment protocols that we've been using for over 18 months now in adults are also available for the most part for children.
County Judge, you mentioned that Army North is sending personnel to 6 states, including Louisiana. We know that as a state we need 13,000 personnel to help fight this COVID surge. While we're struggling for resources, how is it possible for some of our men and women to be helping other states? Are all agencies, including Army North, keeping each other up to date as to how we're doing in personnel here locally?
Well, I didn't hear all that. Did you hear it, Claude? I didn't even.
Could you repeat the question, please?
Yeah.
Sorry about that. So,
Yeah.
alrighty. So let me just to recap on this. County Judge, you mentioned that Army North is sending some of its personnel to 6 states, including Louisiana.
Yeah.
While we're struggling for resources here, how is it possible for us to be helping other states when we ourselves are asking for help?
You know, Army North is a large command. They just happen to be based here in San Antonio. And where they're drawing all those nurses from nationwide, I'm not sure. But they are taking their military personnel and they are helping in 6 states. They did that for a number of months when we had the surge before, but I don't know exactly where they pull them from.
It was announced that medical personnel from out of state would be sent to Texas, including San Antonio, to assist combating COVID-19 in the hospitals. Do you know if any of those nurses have arrived, and if so, how many?
Well, there are 295 that I think they began work yesterday or today.
295 began work yesterday. 315 are expected to arrive in
Yeah.
this coming week.
Yeah.
15 additional nurses?
Correct.
Judge, if we could revisit a couple of your earlier comments. With the 4th court ruling today, does that mean masks in schools will stay in place until December?
Yes, with the ruling as it stands today. But as you know, they'll appeal to the Supreme Court. And that will be interesting. You know, we haven't done too well in the Supreme Court in they may very well knock out the fourth court again. But the interesting thing that's happening in the state, there are a lot of school districts that say they don't care whether the governor's order is legal or not legal. They are going to mandate face masks. That's being done now, I know, by the four largest district. And so it'll be interesting to see if indeed they continue to mandate them, what the Attorney General will try to do. As I stated already, they have sued Pedro Martinez, Superintendent Pedro Martinez, not because of the face mask, but because he's requiring vaccinations. Now, what are the penalties for that? What can they do to him? I don't know. They can take a guy like me that violates because I'm an elected official. They can take steps to remove me from office. That's what they've done to the county judge in Dallas. But the superintendents are not elected officials, so I'm not sure what the penalties would be. I don't think they can take funding away from school districts. But the Attorney General has brought a lawsuit against San Antonio Independent District and Superintendent Pedro Martinez.
Can you tell us again why you think Pedro Martinez is a hero?
I think he's a hero because he's trying to protect children. Most all the school districts here in San Antonio are doing that. It's crazy. It's crazy. It's crazy. Governor had set in place mandatory face masks numerous times. Schools had to do mandatory face masks before. Now we have a iteration of Covet that spreads much faster, more dangerous for young people because younger people are getting. And now they say you shouldn't have to mandate that. I don't get it. I don't understand it. But I know this, that if your kid is in school and there's a teacher that has Covet, or there's a school employee that has it, or another child has it, they're going to pass it to your kid. Now look, we have to do a number of things when we're in a car. We can't text. We got to have turning signals. We can't speed. We got to have seatbelts. Why is that? It's because it's protecting you and someone else. That's exactly what the mask does. It protects you and it protects someone else. You do not have a constitutional right to pass on your disease to someone else.
Dr. Curian, do we have an updated number on how many cases are coming from within the schools or being transmitted within the schools, person to person?
So that should be coming out every Friday.
Okay.
Should be releasing that.
And how effective is contact tracing with the schools when each district seems to have a different strategy?
TA put out a new guidance today that said that schools, may choose to do contact tracing. However, local health departments can still reserve the right to do contact tracing. So I can tell you we will be initiating and completing a contact investigation on every case that is reported to us.
Are we seeing a greater number of city employees testing positive for COVID this go around because of Delta?
We haven't seen that yet. Cumulatively, we've seen slightly over 2,300, if I'm not mistaken, cases to date. But the number of cases we are seeing is not as high as it was way back in the summer surge. You're talking about COSA staff, right?
Yes.
Okay.
Yeah, just would add that right now we know that there are about 173 employees that have been reported to be COVID positive. We do know that there are currently 3 that are hospitalized, so we keep them in our thoughts and prayers. But we're paying attention and we're messaging, and we've already announced about different incentives to encourage and remind employees to get vaccinated. That's really the best way that they can protect themselves.
Do you know whether the 2 city employees who died this week were vaccinated, and does the city have the numbers on the percentage of its employees who are vaccinated?
City is not mandating vaccinations at this time, so it is all voluntary reporting, so we don't have a good estimate because it's not mandated.
Are any city services being impacted, and are we seeing a shortage of staff in some city departments?
Not that we are aware of.
Right. We're monitoring. We report regularly through the city manager's office, so we do make sure that we work with the Human Resources Department and redeploy staff as needed. But we're not aware of departments that are severely impacted by the reported cases.
What is the protocol for when a city employee has tested positive for COVID? How long are they out, and do they have to have a negative test before they come back?
So it's the same protocol that we implement for any case, any positive case in the general population. You can come back to a public setting or come back to work if you meet three of the following criteria, all three of the following criteria, which is 1, 10 days from the date of onset of symptoms or date of test if you're asymptomatic, you're showing symptom improvement, and you're fever-free for at least 24 hours without taking any fever-reducing medication.
And as far as booster shots go, I'm so sorry if this was answered and I didn't hear it. Have we already started distributing those to people who qualify for them, like immunocompromised folks, and do we have enough to accommodate for all of those?
So booster shots, we haven't, because ACIP recommendations have not come down the pipeline. It's expected to come down the week of September 20th. But the third dose vaccines for moderately and severely immunocompromised individuals have begun. And I don't have the number just as to how many have been administered to date.
But that hasn't been like a supply strain.
No, we have enough supply here in our community to meet the demand at this time.
And do we also keep track within the hospital systems of perhaps people who are coming in from outside the Bexar County or city limits?
There's always been, on our hospital numbers, we serve a region, and generally it's about 20%. Dr. Alsop can probably answer that better.
Yeah, it varies, and of course it also can depend on the diagnoses, but as you can imagine, as a large regional referral center, all the hospitals in San Antonio receive patients from throughout South Texas, and so that's not changed with COVID by any means.
And it's been hovering around 20% of all hospital admissions are from outside of Bexar County?
That's in general probably for all hospitals. It could vary, on any given day.
Dr. Alsop, can you kind of explain what our local healthcare systems look like? We can't stress this enough for people. Some still don't believe that a surge is actually happening. Can you help paint a picture?
Well,
Go ahead.
the data would clearly indicate a third surge, at least in this community, is certainly occurring. We've now exceeded the number of total COVID-positive inpatients for all the hospitals that we saw in the summer of 2020, and are approaching the highest peak that we saw during the winter of 2020 to 2021 throughout all the hospitals. As we stated many times, the hospitals are already busy, and this additional burden of COVID-positive inpatients has added to that stress, which is certainly affecting all of the local systems.
As of yesterday, when 1,382, I think, 87% of them were not vaccinated. And that's causing problems for everybody else that's in there. Based on our local numbers, COVID patients now are about 32.7%. So 1/3 of our hospital patients are COVID related.
Yeah, just adding, the reason that we've been communicating to the audience and to the residents about what's happening with the hospitals is that this is placing incredible stress further downstream. So a lot of our mitigation efforts, a lot of our strategies, masking up, reminding folks to get vaccinated, it's in order to decompress what we're seeing further down, what's happening with the hospitals and these admissions. So just keep that in mind that, again, last year you heard a lot about flattening the curve in terms of the pressures that hospitals were seeing. So right now we're trying to stay ahead of the curve by doing what we can in the schools, out in the community, and reminding folks the importance of getting vaccinated. So just keep that in mind.
Are there any messaging efforts you all are working on to make sure that people receive and understand that message?
You're talking about the hospitals or in the community?
In general, like, is there a messaging effort that you're specifically targeting to make sure people are no longer hesitant to get the vaccine or mask up?
Vaccine hesitancy and vaccine apathy, that's real. And so we have been tailoring our messaging. August is National Immunization Awareness Month. We're amplifying our messaging, working in concert with our partners in the county, just making sure that folks understand the importance of getting vaccinated. It's in different languages. We're trying to make sure that we at least get to the trusted sources in community, just to make sure that folks understand, while it is a personal decision, while there is not a mandate, we are reminding folks of the importance of getting vaccinated. And let's be clear, what we're seeing, what we're experiencing right now is a pandemic of the unvaccinated. That's what we're talking about in terms of the admissions and the pressures on the hospital systems. So the message is clear: get vaccinated. And really, the reason we're reminding folks to mask up is that this is the other option for protecting oneself.
Yeah, we're both, the city and the county has an advertising campaign going on too also. I know we appropriated, I think, $300,000. I know that the city is doing an outreach program, but it's a pretty trite saying. You can lead a horse to water, but you can't make him drink it. And there's 45% of those that say they don't care what happens, they're never going to take it. So, but there's still people out there that are considering it and just simply put it off, and that's who we're hoping will get vaccinated.
I'm not sure if you guys have heard this, but we've heard from Pleasanton doctors who say they haven't received vaccines to give to their residents. Over in Medina County, they've turned their waiting area into a hospital bed space. What is the likelihood that we're going to start seeing some of those patients, because they're saying that there's not enough bed space here locally to get them transferred here? And can you explain how that will impact the already dwindling bed space?
I don't understand. You get it?
Medina County has a lot of folks who are waiting for hospital beds, and doctors' offices have.
Ron, you want to take that?
Yeah.
I think that's being seen throughout the state of Texas. Those referral patterns that we referenced earlier that come to large centers in urban areas like San Antonio are having a hard time transferring patients simply because the capacity issues that exist here. And that's a reality we're seeing throughout the state.
So what happens to those patients?
Only do load sharing, load bearing and load sharing. So they don't necessarily have to come in here. If we don't have beds, they can be shared across the state.
Is there anything that the city of San Antonio is going to do to make sure that these patients can actually get in the hospital? I don't know if you guys saw this, but Medina County is actually placing a tent outside where they're starting to treat COVID patients.
Yeah. Well, the load bearing that Dr. Kurian referenced is a daily occurrence, even pre-pandemic. So as I mentioned, the percentages of patients that we see from across South Texas has always been the case. And sometimes, depending on where the pandemic has occurred over the past year and a half, it's been higher in certain areas of Texas, and sometimes those patients can be transferred to other parts of the state. One of the challenges we're seeing now is that some of those areas are as full as we are seeing in San Antonio. And there have been some cases where patients are actually transferred to other states. So it really depends on where the capacity exists to receive those patients.
Well, we don't have any representatives from our legal team here tonight. I was wondering whether any of you could help us with this. Is it legal for parents to take their children out of school for a semester or a year to prevent them from being contaminated with COVID?
That's a good question. I know school is mandatory. Wow.
There are options for parents. Parents can choose to homeschool if they wanna.
Yeah.
But I think
they could do homeschool. Yeah, that's for sure.
Yeah, Judge can comment. I think San Antonio led the effort in decriminalizing truancy. I'm not a lawyer, so I'll stop now.
It's a good question. Good question. I'm not
We'll look into that.
sure. Not sure.
Does the city plan to set up a site for booster shots?
One side, go ahead.
Okay, so we are closely monitoring the situation. So the situation today or now is quite different from what the situation was way back when the vaccine implementation was rolled out. So at that time, vaccines were not readily available. Registered COVID-19 vaccine providers were very few and far between. Today, we have over 1,300 vaccine providers who can administer the vaccines. Vaccines are widely available, easily accessible. So we are going to be monitoring once the third booster or once the booster shot administration begins. We'll be monitoring the situation, but at this time, we expect all these other sites, additional sites that are already there to be giving out, and we will continue with our Alamo Dome operations. Judge already mentioned that UHS is going to stand up the mass vaccination site at Wonderland. Our pop-up events will continue. We'll be offering booster shots at these events as well.
Dr. Alsip, what exactly is in the Regeneron antibody treatment?
Well, it's often referred to as a cocktail. It essentially means it has two different types of medications that are monoclonal antibodies that essentially mimic the kinds of antibody response your own body would have, whether it were received from a vaccine or natural immunity. And since Regeneron is usually recommended early in the course of illness, before severe illness occurs, it's thought essentially to reduce the severity of illness and prevent people, in many cases, from actually having to be hospitalized or even present to an emergency department.
Dr. Kurian, can you please confirm the total number of deaths since the pandemic started here in Bexar County, and how many are under investigation?
We have, go ahead.
So the deaths to date, we have 3,710 reported deaths, 7 new deaths reported this week. Was that the only question about deaths, or was it also about cases? Currently under investigation. How many do we have under investigation?
We have quite about 5 or 6 still under investigation, and under investigation we mean we are trying to determine the jurisdiction. So.
Can you update us on whether you all have gotten the CDC approval for the $100 incentives to get people vaccinated?
Yes, we did, and we are in the process of rolling it out.
And with that approval, does that mean we know for sure it's going to be happening in the form of gift cards, and will each incentive be paid out as $100, not like different varying amounts?
So we got the approval just late yesterday evening, and the plan is to give it out as a $100 HEB gift card. It'll be given at the end of your second dose, or at the time of your second dose administration. And again, we have to wait for our processes to roll out.
And do we yet have the breakdown of pediatric COVID cases historically, whether that be who, like each day, how many were admitted, how many have been in the hospital each day?
Brian,
Today
do you
we
have
have 22 in the hospital, and that's something that STRAC has to.
We don't have that, do we, Brian?
I think the number is pretty close in terms of either new admissions or pediatric total patients that are COVID positive within the hospitals. It represents still, at least for those under the age of 18, a relatively smaller percentage, although those children are very ill.
So for today, reporting 212 new admissions, 22 of which were pediatric cases.
20, probably close to 22 of the people in the hospital right now in Bexar County are pediatric cases.
Right.
Is that because they get better sooner, or is that something we see consistently, that the turnover is pretty constant?
Right, I didn't follow. Repeat that second part of your
Well,
question.
like, in my head, I'm like, new admissions 22, okay, but you add that to, like, the 10 kids that are already there.
Yeah, it's just one day.
Dr. Kurian, does the city, can you tell us when y'all might roll out the gift card program?
We have to wait for certain approval to be had before we roll it out. So tentatively by the end of this month. Yeah.
You may say something real quick on behalf of Bexar County employees. You have to October the 31st to get vaccinated. All those that have been vaccinated or will get vaccinated by October 21st will be eligible for a $1,000 rebate on their health insurance program. We're starting to get those in now, those that are providing the evidence of their vaccination. October 31st, we will know how many have got it, how many have not got it, and then they will be eligible to receive a refund on their insurance. So if you're a Bexar County employee and you haven't got your vaccinations, if you want to participate in this program, you got a couple of months or so to get it.
Dr. Alsip, last question. Can you kind of explain to parents how severe these pediatric COVID cases are?
Well, they're as severe as adult COVID patients that we've seen for some time now. And the pediatric patients aren't necessarily new, but I think they're getting a lot more attention simply because, in general, we're seeing a younger patient on average present to the hospitals, and a lot of that has to do with the fact that many of the older patients are now immunized, and that's the best protection against hospitalization. So that's probably what we're seeing most now.
That's all we have tonight. Thank you.
Thank you.
All right, thank you.